Neurology, Physiology, and Anatomy, the cerebral cortex regions. All right, so for the cerebral cortex regions, this is very high yield because on the MBME, they love to show you a photo of a diagram of a brain or a gross pathology of a brain, okay? They will show you and they will point to or add letters in locations of the brain. So what you need to do right now is look up a diagram of the brain and the locations in which you will see different regions, okay? That is going to be a lot of questions on your exam. You're going to thank me for it because it's so high yield. So let's start off with the lobes. You have the frontal lobe located at the frontal part of the brain and superior portion. You have the parietal lobe, which is in the posterior portion superiorly. Then you have the temporal lobe, which is on the sides near the temples, hence the name temporal lobe. And then lastly, you have the occipital lobe, which is located completely posterior. Okay, those are the four lobes. Now let's talk about what specifically is in each lobe that's high yield. First, you have the frontal lobe. The frontal lobe is going to be separated from the parietal lobe via the central sulcus. So always identify your central sulcus first, okay? When you have identified the central sulcus, in front of the central sulcus is going to be your primary motor, essentially gyrus, okay? And behind the central sulcus is going to be your primary somatosensory gyrus, okay? So that's going to be the two locations in the brain that you need to pick out first. The central sulcus, and then in front of it is our primary motor location, and behind it is our primary somatosensory location. Now, what you need to know also within the frontal lobe is Broca's area. Broca's area is very important, okay? It's going to be located on the inferior aspect of the frontal lobe, right above the temporal lobe, okay? But it is, in fact, located on the lateral inferior aspect of the frontal lobe. You have to know that, okay? Now, the reason that's important is because they will have a patient that potentially has Broca's aphasia, which we'll talk about later on, but essentially they just have broken speech, okay? But it's because we have some type of inability to get blood, or they just have essentially a stroke at the location of the Broca's area. So they have Broca's aphasia, and that's due to the location being at the inferior portion of the frontal gyrus, okay? Inferior frontal gyrus damage, okay? Look it up. Ask Google. Like, just go ask Google where Broca's area is because it's so important. They will ask you it 1,000,000 times, okay? Next, and lastly, for the frontal lobe, is that you have our prefrontal cortex, okay? And the prefrontal cortex is essentially involved with all of our personalities, the language, the motor function, and abstraction, okay? So a patient that has like frontal lobe lesion, they will not be the same, okay? They will have like difficulty with their personalities. Their personality will be different, okay? If it hits the Broca's area, you'll have Broca's aphasia, okay? And lastly, they might not be able to discern the differences between two objects. So if you have a question that asks you, you give a patient like a pencil and a watch, and they're like, I don't know what the hell each one of these is. Well, there you go. There's some type of damage within the frontal lobe, okay? Because you have an inability to discern the differences between the two objects because abstraction comes from the frontal lobe. Okay, next is going to be our parietal lobe. We already discussed. This is where majority of our somatosensory information is going to stem from. What we feel, okay? How we feel, that's going to be parietal lobe, okay? Not like emotionally, but like literally me touching something, what I feel. Okay. Next is going to be the temporal lobe. Temporal lobe, what I really want you to know about the temporal lobe is going to be one, the Wernicke's area. Wernicke's area is located at the superior portion of the temporal lobe. Okay. You have to know that. Take a look on Google right now. Where is Wernicke's area? Okay. Where can I find it on a diagram or on a gross anatomy picture of a brain? Because they might ask you a question where a patient has Wernicke's aphasia. Okay. And it's just word salad. They're just spewing out all this information. Okay. They're going to point at a photo on the brain. You have to be able to identify the area, okay? Lastly is the occipital lobe. Occipital lobe is very easily named. It's because it helps us with primary visual cortex. It helps us visualize things, okay? I hope that helps with our cerebral cortex. I promise you that if you do not know where any location is on the brain, it's going to take away some points on the MBME. Understand how a brain looks like and what regions are important on the brain and be able to point them out on a diagram or on gross anatomy photos because that will show up on your exam 1,000%.